attending this talk. Despite that we are gathering here virtually today, it is important to recognize and honor the traditional lands upon many of us are situated. We not only recognize but encourage others to note that the Haudenosaunee and Anishinaabeg nations are the traditional inhabitants of the lands where McMaster stands. This is an important opportunity for us to acknowledge the debt that we to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. Now, before I introduce our very special guest speaker, I would like to acknowledge that the Institute and the Faculty of Social Science Initiative for Advanced Research on Mental Health and Society, or ARMS, are hosting today's seminar in partnership with McMaster's Canadian Housing Evidence Collaborative, or what is commonly referred to as CHEC. We extend thanks to Dr. Jim Dunn, the director of CHEC, for his support. Now, we are so pleased to have Dr. Pat Ocampo join us to discuss her research on housing supports for women experiencing precarious housing. Dr. Ocampo is a professor of public health at the University of Toronto and a Canadian Research Chair in Population Health Intervention Research. I was fortunate enough to be mentored just briefly by Dr. Ocampo during my PhD studies. She is beyond a doubt the most intelligent, creative, and vigorous researchers I have ever met. It is notable that Dr. Ocampo has published over 450 articles. And for those of you familiar with Google Scholar data, she has an H citation index of over 210, which is huge. Dr. Ocampo's incredibly influential work focuses on the upstream determinants of health, quantifying the impacts of structural issues and social programs, with a focus on concrete solutions to complex social problems. So with all that said, it is my extreme honor to extend the virtual floor to you, Dr. Pat Ocampo, to discuss your most recent research.
Thank you so much, Marissa, for that wonderful, amazing introduction. Although I don't think my H index is 200, but and for inviting me. So I'm really excited to be here. You know, when I don't necessarily accept invitations to be on Zoom more, but when I was presenting, when I was preparing for this talk, I really got excited about it. So thank you so much. All right, so let me see if I can do my technology here. Okay, I'm hoping that you can see my slides. So I'm talking about housing supports for women who are experiencing precarious housing and okay, yeah. Of course, I'm having technology problems. There we go. So I thought I'd begin by just giving you an overview of what I hope you're going to take home today in terms of messages. That, you know, Canada has guaranteed housing as a human right, yet it falls short on delivering on this promise. That research on and the policy solutions to affordable quality housing often fail to sufficiently consider women's unique needs and circumstances, and that's what I'll spend my time demonstrating. And if we stay on this path, and I suspect we are going to stay on this path, the inequities created by this gap, by these gaps, are going to continue to widen. All right, I'm beginning actually with some information from you. So I'm hoping that you would be willing to go to pollev.com, Pat Ocampo 199, and let's see if I can show that, because I have a survey for you to do. Let's see, but you're not seeing my, are you seeing my screen? Probably not.
No, but it's in the chat.
All right, good. Let me, okay. Thanks to those who've started. Okay. Now can you see my screen?
Yes.
Okay, great. Okay, so I just wanted to get a sense from you about what your experience is working on housing issues or doing housing research. So Data still coming in. I'll give it another 30 seconds. So great. We have some people who don't know much. That's great. Hopefully you'll learn a few things. We have some people who are working on this, or that's their housing issue. I know where Jim's answer is going to be. And then we have some people who are somewhat familiar. So that's great. Okay, glad that I can share what I'm sharing with you today. Now, let me see if I can just move this away. Okay, now can you see my slides? Oh no, it says screen sharing has paused.
Yeah, that's
Okay,
good.
There we go.
great. Okay, thank you for giving me an idea about how much you have worked on housing issues. This is very helpful. So, as I mentioned, housing is a fundamental human right, but housing issues today in Canada really have reached crisis level. You know, we have, for example, in the bottom left, there are a number of people who are forced to move, not voluntarily, but because of some action like eviction or financial issue or a landlord pushing them out, they've been forced to move. So that happens too frequently, unfortunately, across Canada. There have been promises and commitments to make housing more affordable by the federal government. We'll talk a little bit about that later, the National Housing Strategy. We have even the economists talking about how housing is a horrible blunder. And even some people talking about trying to increase your income by having richer parents so that you can afford a home. Other data show more dire statistics. So the wages, for example, that are needed for just to get a 1-bedroom apartment in a city compared to the minimum wage and the gap is huge in some cities like Toronto and Vancouver. So minimum wage falls short of being able to let individuals afford a 1-bedroom apartment, especially in Toronto, with minimum wage just under $15. But the wage that you need to afford a 1-bedroom apartment there is about $27 an hour. Vancouver's facing a similar situation. So you can see that city after city, you cannot afford a 1-bedroom apartment on a minimum wage in many of these cities. And the list continues down the line if you want to take a look at it. And this slide, or so the data on the top right is showing you the wages of various occupations or job titles. So if you're in the food and beverage sector, you might be making $12 an hour, clearly not enough. If you're a courier, then $13 an hour, that's not enough. And so you can see that maybe it isn't until you get to be an administrative assistant that you're beginning to make a wage just to get you a 1-bedroom apartment. So evictions is something that there isn't enough attention on. The problem is getting bigger and bigger, and the help that individuals who are at risk of eviction needs, for example, legal help, is also quite challenging to access. So if we look at evictions as a proportion of renters across the country in different cities, we can see that it varies, but it's quite high, for example, in Toronto. So we're talking about 11%, and in Ontario as a whole, it's 10%. That's very, very high. And also in Calgary and Winnipeg, we have high numbers there too. It's much lower in Quebec and in Montreal, but still, we shouldn't be experiencing such high rates across the country. And if we look at how much additional money an individual has to pay once they're evicted, especially if they've been in their rental for a long time. Their housing costs in their next rental rises. In Vancouver by almost 20%, in Toronto by 20%, and in Montreal over 30%. And so that's how quickly rental rates are rising in those cities. So we often present these data as if everybody has the same experiences. And so let's take a look at the situation described by the organization who looks at homelessness and women's unique needs. And so they talk about the real scale of women's homelessness and housing need. They talk about the real scale in part because women's homelessness is often described as a problem that's not very visible. And so it's harder to see and harder to measure and harder to recognize as a problem among women. So this is very hard to read. So I've kind of cut up this figure here into two. So you can see the top half here of this figure, and it shows you some very important statistics. So poverty obviously is related to housing, and 21% of single mothers in Canada raise their children in poverty. That's 1 in 5. 7% of women identifying Canadians have experienced hidden homelessness at some point in their lives. And 28% of women-led households are in core housing need. So they need better supports for their housing or need better housing. 27% of women-led lone parent family households are in core housing need, compared to 16% of male-led family households. And recently, over 68,000 women and children were admitted to domestic violence shelters in Canada. And you can see, I think, the other half of the figure shows you how many women are actually turned away. So let's look at the second half, the bottom half of this figure. And so we can see in the bottom right, on a single day, and they looked at this in 2018, almost 700 women and 236 accompanying children were turned away from domestic violence shelters across Canada. That's in a single day, and that has gotten worse during COVID. So there is a need for much more supports for women who are fleeing violence or homeless because they have fled violence. So we have some data about women on reserves. 42% of women living on reserves live in houses that are in need of major repairs. And then 9,000 women and girls experiencing homelessness reside in shelters, unsheltered locations, and transitional housing across 61 communities in Canada. So these numbers tell you how women are experiencing unique situations when it comes to precarious housing and homelessness. Actually, I haven't told you a definition of precarious housing, but if you are living in precarious housing, then you're living in housing that is unaffordable, in need of repair. You might be at risk of eviction. You might have no roof over your head. So that's the definition of precarious housing that we're working with. So, you know, the causes of these problems are not just, even though I've shown you some statistics about what women are experiencing, the problem isn't only at the individual level. Many of you probably know this old figure here from the Commission on the Social Determinants of Health, which shows what the determinants are at the intermediary level and then at the structural level of health inequalities. And we have here housing as highlighted both at the individual level. So you can barely see my highlight here, but living conditions at the individual level Here is highlighted under material circumstances, and then way over on the left at the structural determinants of health, that is the root causes, we've got housing policies here. But clearly this problem is more than just a housing specific problem, because it has been identified that women, especially women living in chronic poverty, need more than just a roof over their head in order to solve their precarious housing issues. So if we were to look more closely at this figure, we can see that certainly public policies, for example, social protection policies, the macroeconomic policies, governance and politics that determines who we will pay attention to, whose needs we will pay attention to in society. Societal values down at the bottom all help determine whether or not we should be or are facing the housing crisis that we currently are facing. All of this is preventable if we were to address those issues. I've also highlighted the middle column here because those factors that I just mentioned to you all coalesce to create gradients by social class, gender, and ethnicity, which also influence housing conditions at the individual level. So we have to address all of these issues if we are to help improve housing supports for women who are living with precarious housing. You know, some people wonder if poverty is really the same thing as being precariously housed. And so a while ago, we did a study looking at that and trying to compare a very hard outcome, mortality, among individuals who were living in precarious housing compared to those who have very low income. And we were able to use a very large data set. I did this with Jim Dunn. Let's see. A national data set with 11 years of follow-up to measure mortality after the year in which their housing situation was measured. So women were identified living in shelters, rooming houses, and hotels. And we compared them to three groups: the wealthiest Canadians, all Canadians, and poor Canadians. I'm not showing you all of the data, but I will show you the data here for all Canadians and then the poorest Canadians. So what you're seeing here are mortality rate ratios comparing those who are precariously housed versus all Canadians, these three bars on the left. And what you're seeing is that if the bar is greater than 1, then those who are precariously housed have higher rates of mortality. So if you look at the green bar, those are the youngest individuals. So you wouldn't expect high mortality there. And there's the highest difference there compared to all Canadians. So women who were living in shelters, rooming houses, and hotels over an 11-year period had 4 times the mortality rate if they were 25 to 34 compared to the average Canadian woman of that age. And the same goes, you could apply that to the other age groups in these 3 bars on the left. But what was surprising is the bars on the right, because if being poor was equivalent to being precariously housed, then you would see all the bars at 1. But you can see all the bars are above 1. So again, if you take the youngest group, women who were living in shelters, rooming houses, and hotels compared to the poorest women Canadians, there was still almost a 3 times higher mortality rate compared to those who were poor. And so this suggests that there's something about being precariously housed which affects individuals, affects their well-being, affects their health, affects their risk of dying, up and over just being poor. So what is that? Let's try and unpack housing a little bit and what's important about housing. So some of the ways in which housing has found to be important are that crowding, which is another feature of precarious housing that I think I might not have mentioned in the definition. Crowding has been demonstrated to be associated with an increased risk of infectious diseases and also impaired child development. Some houses have trouble with temperature control or dampness. And so if you have poor ventilation and mold, it's been demonstrated that there's individuals that have greater respiratory problems or exacerbated allergies, high cholesterol and blood pressure, and even higher mortality rates. Indoor air quality, which can be a form of poisoning, affects respiratory issues and even cancer. And then, of course, there's structural issues, which can lead to injuries, burns, and fires. We can't forget that cost is a really big part of the housing crisis now. And so individuals are having to pay much more of their income much more of their income goes toward housing costs. The ideal rate is 30% or less of your income is spent on housing, but there's lots of data to show that many families and many households in Canada are spending 50% or more on housing, which leads to economic strain, poverty, and then of course fewer choices in location or having to go without in other necessities of life because you have to pay for housing. So there are multiple dimensions of housing that impact health, and sadly, we don't always pay attention to those. So there's clearly the physical features that matter, you know, whether you have a roof over your head, some of the structural issues that I mentioned, temperature, dampness, we already talked about why those are important. And oftentimes in studies, we just stop there. And we don't pay attention to other features of housing that are important. So there is the psychological aspect of housing, ontological security, the meaningful, what housing means to us. So the feelings of home, sometimes homes and neighborhoods give us social status. It can help build your identity. And so these are really important. I'm just showing you an ad here for the sale of a condo, I think. And clearly they're not emphasizing bricks and mortar here. They're definitely emphasizing how happy this couple is to have this condo. And so they understand the importance, the real estate people understand the importance of the psychological aspects of housing and probably emphasize that more. Here's another ad emphasizing the psychological benefits of good housing over bricks and mortar. And then, of course, there is your location and neighborhood. You need your neighborhood to be near resources. Also, you need your neighborhood to be safe. And oftentimes people choose neighborhoods because they think that their neighbors will be like them and like-minded. So these are all three aspects of housing is very important for us to consider. In fact, when we asked individuals, kind of unprompted, other than, you know, what does it mean to have a home? They told us about what it means to them, and they emphasize things other than the physical features. The other thing to remember about these dimensions is that they don't travel together. Just because you have a roof over your head doesn't mean it's in a great neighborhood or that it's going to make you feel great. So that each dimension has its own pattern and dynamics. So this is the from the at-home Chez Soi study on housing first in Canada. And we did some qualitative interviews. And when we asked them, what does it mean to be stably housed? This participant talked about self-identity. She reflected about her son, that he's not with me, but when he comes back, I want him to be proud of his mom. And that's my goal, to make my child come back home to me and be like, my mother is something. That's what housing meant to her. Another participant talked about being in control within the home and feeling free from surveillance. free to be themselves. So this individual reflected that housing stability has an impact in terms of security, tranquility, peace, and having a space of one's own in which one can do whatever one feels like doing, including behaving in strange ways without being constantly in the public eye. We did another study across Ontario, asking women who were living with violence or had a history of recent violence about what housing stability means to them. And one participant said it means living in one place for an amount of time, not moving from pillar to post like I had been doing. Stability. Just for me, it means living in a normal atmosphere, which is constant, has consistency, has routine. All those things, that everything is financially looked after, regular, like regular folk. You know, to do homework, my daughter going to school, stability, just not that chaos, talking things out, having boundaries, all that stuff is involved. So you can see that the psychological aspect of housing is very prominent when we ask people unprompted what housing means. And so we need to look more at this feature of housing, and we don't do that enough in our research. So we've talked about these dimensions here, the financial, the physical, the psychological, and the locational. Those are all important when it comes to housing, and we should be looking at all of those dimensions. But we don't, oftentimes we ask fairly straightforward and simple questions like, you know, do you rent or do you own? Where do you live, so that we can assign a neighborhood to that address? Or do you live alone or with others, and how many rooms in your home? We don't actually cover all the important dimensions. And too often housing issues are presented as gender blind. Some of the data that I shared with you in the beginning of the talk did not disaggregate data by gender. So we often just assume that everybody has the same experiences. And so gender blind approaches in studying housing and also in designing housing solutions tend to be gender blind, and gender blind approaches by default tend to be male-centered. So one framework that we can consider using is the gender transformation continuum, where we have gender blind at one end, which is the default. We can be gender sensitive, that is being aware that there are gender differences, or we can be gender transformative. And that means taking some of the resources and really redistributing to make up for some of the prior inequities that we've been living with, and potentially giving more and different resources to women to overcome the gender blind approaches that we've been relying on so far. So what if we were to take a gender sensitive approach? How would we be thinking about housing? So housing impacts women. These dimensions of housing, women experience them differently than men do. So for example, for the physical housing, we have, sorry, I can't see all my screen. Wait, maybe I can do this here. That little bar at the top. Okay, more women live in substandard and crowded housing than men do, in part because they live in smaller units, they can't afford bigger units, and they have less choice. Women have lower wages, even if they do the same job, and are more likely to be or underemployed. More lone mothers live in poverty, as we saw from the statistics before. And social assistance does not cover household expenses or rent. The grants are very low. So they have more financial challenges. Women have fewer choices about where to live, in part because of what we just talked about in terms of finances. Women experience discrimination by landlords. Women experiencing violence definitely experience discrimination by landlords. And women have a greater need to be closer to services and closer to work. They need shorter commute times because they're often the ones who have to go home if a child is sent home from school or is sick. And so they can't be commuting 2 hours each way just to go pick up their child. And more women are living, therefore, without the psychological or physical security in the home. These, as I mentioned before, dynamic patterns make finding easy solutions difficult, again, because these issues don't travel together. Another issue that we don't pay enough attention to is the role of trauma and violence in creating homelessness and precarious housing. So in a survey, they found that 93% of homeless mothers have experienced trauma. And the most common form of trauma is due to violence by families or known perpetrators. And so we may need trauma-informed services, and we may need or linkage to mental health services or other kinds of supports, which we rarely think about when we think about housing or supporting homeless women. And then again, this is just showing you that although we call homelessness a hidden problem among women, that there in fact are a large proportion of women who are affected by homelessness. So, you know, what is the state of our research on housing precarity? Sadly, few studies, despite calls for better gender-sensitive research for many, many years, approach housing and housing precarity and homelessness using a gender-sensitive approach. Usually it's a one-size-fits-all, everyone is affected in this way. There was about 10 years ago, a study published or a commentary published about how we don't consider women's needs enough. And Melissa Perry and I decided to revisit that issue to see how things have improved over time. And we found that it hasn't improved at all over the 10 years. And there have been calls, you know, since the late 70s to do more of this gender sensitive approach to studying issues related to women in housing. And it hasn't changed. The needle has not moved. So our understanding of the unique needs of women is limited. Often it's done in this way to understand kind of the crises after the crisis has happened. So we have surveys of women who are homeless, but we don't really have very much information on what that journey is like. When did it begin? And so we need to have more information if we're going to come up with the right solutions. And while we have some research that looks at women and men differently, comparing a lot of women to men, as if men are the norm, we have almost no studies that really use a gender transformative approach. You know, what does that mean, a gender transformative approach? Let me give you one example of what that might look like for one intervention. So we've got our continuum here, and we often approach things that are in a gender blind way. So the portable housing benefit, that means everyone is treated the same. But if we had a gender transformative approach to the portable housing benefit, it would actually have a number of features that we don't see in the current iteration of it. And are you going to be able to see it? Or is it not going to show up on my screen? I think it's not going to show up on my screen. All right, well, I'll tell you what it's supposed to say. So if we had a gender transformative approach, and imagine this list is going to be appear under gender transformative, the currently the benefit amount just varies by household size. So the benefit amount might vary by household circumstances. Maybe you have more kids and you have more costs, so it might vary also by the household costs that you have. The portable benefit, if it were gender transformative, would include a component to address pervasive landlord discrimination against women. Single mothers and women who are fleeing from violence, racialized women, there's all kinds of discrimination that's happening that keep women from effectively using their portable housing benefit. It might include some funds to address some home security issues. Women who are fleeing violence may need to have reinforced doors or windows. And so maybe the portable housing benefit could come with some funds to address that issue. So women, as I mentioned before, need to live in neighborhoods that are close to work. So maybe there could be a way to incentivize landlords to support women to live in safe and convenient neighborhoods. And then finally, there might be programs that are part of this whole benefit that would increase the income security for participants. So they could do away with having to participate in these programs. But we know that women's poverty is chronic. It's about low pay or the kinds of precarious jobs that they usually have to access. And so there could be a program to increase their income security. So a gender transformative portable housing benefit would have some or all of these features to address women's unique needs. Okay, well, good news, because actually there is some research that's coming out on gender transformative approaches to understanding women's housing and homelessness. This report, Pan-Canadian Women's Housing and Homelessness Survey, was released earlier this year, and it was done by the Women's National Housing and Homelessness Network, and also the This Is Not Home Project. This Is Not Home Project is a group of individuals who are working with women who are most marginalized, and together they did this Pan-Canadian Housing, Homelessness Survey. And it's really academic community partnerships with leadership by individuals with lived expertise and experience. And so in that sense, they really put a great study together. Like, look at these research questions. I think they're really great. Love them. What are the key housing challenges facing women and gender diverse peoples, and how do they navigate those difficulties? How do public systems, so child welfare, criminal justice, contribute to and correlate with housing instability and homelessness in the lives of women, girls, and gender diverse people? What housing rights violations are being experienced by women, girls, and gender diverse people, and what barriers do these groups face when seeking justice? How does poverty, housing precarity, and violence intersect over the life course of women and girls and gender diverse peoples? And what policy and practice change is needed to effectively address homelessness and housing need for women, girls, and gender diverse people in Canada? So I'm not going to tell you the answers to these because you can read this report, although I will try and summarize in a slide some of the things that they've found. So, you know, at the root is really chronic poverty. For many participants in this survey, this national survey, chronic poverty beginning in childhood was linked to housing stability, and housing stability began often in childhood. So they were experiencing, so it gets to that life course issue. Even though they're living in chronic poverty now, many of them were unable to access government benefits like OW or ODSP that wouldn't solve their housing cost problems, but can contribute to part of the solution. There were a lot of safety concerns that affected these women's lives that undermined their housing stability. So it could be where they lived, it could be who they lived with, it could be a situation of violence, And because a relationship breakup was the primary reason for losing housing, some of that was due to violence. So there's that cycle of safety concerns, relationship breakup, chronic poverty, kind of keeps women in unstable housing situations. Now, if, and also 75% of women and gender diverse people are survivors of abuse and trauma. So that cycle that I just described to you is quite prevalent. If women lose housing as a result of their instability, because they're at very high risk of eviction, many of them could not access legal advice in a timely fashion and therefore lost their housing. So legal help is available, but for one reason or another, they couldn't access it, and then they lost their housing. And then they also, when they lost their housing, they needed to access emergency beds, but a high proportion of women could not access emergency beds because of capacity issues. And we talked earlier about the statistics showing how many women are actually turned away from shelters, for example. And then cutting across this whole thing is that there's discrimination and disability, which is prevalent in this population, and it affects all the steps in the pathway, especially discrimination. And so it's true that this was maybe a unique population because they really reached out to try and get women who were very precariously housed, homeless, individuals who were gender diverse, who experienced a lot of discrimination. But what's clear is that these issues don't occur in isolation. So it's not just poverty and housing. In fact, it's, a history of safety concerns. It's maybe a history of going into debt. The statistic I didn't show you is that 1/3 of these women go into debt just to pay their housing costs each month, whether it's, going to the money mart or maxing out their credit cards. And so it creates a situation where they're facing multiple challenges. And so you have to have solutions that are going to address these multiple challenges. So key challenges don't occur in isolation, and the solutions must support this dynamic complexity. So we've got like a portable housing benefit, but that alone isn't going to support women who are fleeing violence. Okay, so let's see, how are we doing on time? So let me maybe quickly go through Canada's National Housing Strategy. It's a comprehensive strategy to address the housing crisis, issues like financing home ownership, to building new affordable renting units, to creating rent subsidies and eliminating homelessness. Those are all part of this national strategy. Thank goodness it's here. We're really happy, but a lot of it, at least as described in the strategy, seems to be gender blind or gender sensitive and very little gender transformative approaches. For example, let's just take the description of making homelessness history. Is it gender transformative? Well, I'd say it's either gender blind or gender sensitive towards supporting men. So if you look to see what the strategy talks about, it talks about helping male veterans as a group needing unique supports, and I'm sure that they do, but they talk about trauma in there, right? So, but the trauma that they talk about is supporting combat-related trauma for men. Now, if it were gender transformative, it would recognize the unique needs of female active duty veterans, including high proportions of lifetime trauma and PTSD. Actually, a lot of women go into the military to escape childhood abuse. And so there's a lot of trauma there, and it wouldn't just address trauma after it happened or after they served. Maybe during active duty, there would be programs to address trauma. They would provide preventive services during active duty, reduce military service induced trauma, because there is trauma and abuse that happens in the military to women. So they would have programs to effectively reduce that. And there would be treatment of trauma as prevention for homelessness, creating a safe place to disclose traumatic experiences for everybody, having a focus on eviction prevention, recognize partner violence as the primary cause of homelessness among women, and then implement partner-related homelessness prevention. So that's not in the report, sadly, but if they were gender transformative, they would be doing that. So maybe you can take a look at this Canada National Housing Strategy document, and then, whoops, my other piece of information is not showing there because I assigned you some homework. I know that that's what you came here to get homework. So I was going to ask you to look through the strategy and determine which strategies are gender sensitive and which might be gender transformative. And I am thinking that maybe I should not go into this last example that I wanted to show you, partner violence, because I've talked about that quite a bit. And there is a new national action plan, a roadmap for eliminating violence against women and gender-based violence. And I think the last thing, and the plan is asking not for millions, but billions of dollars because of the comprehensive issues and the comprehensive challenges that I've mentioned to you earlier. But it's actually not clear how this coordinates with the National Housing Strategy. So that's one gap that we've got to look at. So more homework, there's your second homework. Look through the National Action Plan and learn more about how the gender transformative approach is applied. Okay, we're here at the end. So Canada lacks solutions informed by gender transformative approaches to support women with precarious housing conditions, leaving a serious gap. Gender transformative research, defining the problem and identifying corresponding solutions, is also lacking. But change is on the horizon. We had that amazing Pan-Canadian household survey and the National Action Plan to eliminate gender-based violence. So how can you help to make these necessary changes? I'll leave you with two questions. What gender transformative research are you aware of, or gender transformative programs? Whoops, program should have been in here too. So please share in the chat what gender transformative programs or research you're aware of, and what is one thing you'll do differently to promote gender transformation in your own area of research and work. Thank you. So I'll stop sharing. Okay.
Okay, thank you very much, Dr. Ocampo. And we can keep an eye on the chat, I think, if people want to share based on your examples. Oh,
thanks. Yeah, great. The YWCA. Yes, agree. They have some great programs there that are absolutely gender transformative. Thank you for sharing. Oh, thanks, Jim. Great. So the data set is available in chat. Excellent. Thank you. So I'm happy to take questions or comments or.
Sorry, Pat. It's available in the RDC. It's now, that data set is now called the CanCheck data set. I know it shares a name with Check,
okay,
the housing collaborative, but okay. It's available in the RDC though, if anyone's interested.
Okay, great. And I think it has more years of follow-up too, doesn't it? Yeah, great.
Okay, yeah, and I think if anyone has questions for Dr. Ocampo in the chat, or you can raise your hand. We've got some time for that, a few minutes.
I'll get the ball rolling, maybe while everyone is thinking of their questions. First, thank you, Dr. Ocampo, for such an amazing talk. And I think one of the things that I wanted to hear a bit more about is particularly around the definition you provided of precarious housing, and knowing that the different determinants you used, we know are very well available, at least now in census data. And I'm wondering, like, what is the prevalence of precarious housing across Canada generally, right? I don't know if you've looked at those numbers, but even if, based on a lot of the work that you've done, if you could even just kind of guesstimate.
Yeah, I really don't know. Actually, I'm wondering if Jim knows this data better than I do. I've not looked at the census data. And so, you know, I've heard of, you know, the elements separately, but not put together who might be experiencing any one of these. Jim, do you know the answer?
Well, there's a little bit. Census is not connected to very many things, I think is the short answer. So in fact, that CanCheck data set is one of the few things it is connected to. So it's individual census records. It's a 15% sample of the people who filed a long form in the census connected to their mortality records. And then there's two cohorts. There's a 91 cohort and a 2001 cohort, and then they're followed through time. So the 91 cohort is now followed through time for very long. But yeah, generally there's not much. The difficulty, of course, is connecting the thing you're interested in to the housing information. The Canadian Housing Survey is pretty rich, though. There's a lot of new data there. And yeah, anyways, that's something that we're actually kind of working on right now with Check, is building out new data sources and trying to help people navigate the data sources that are available.
Great, thanks.
Thank you.
And Medora, if you'd like to unmute and ask your question.
Oh, thank you. And I am sorry, I came in late to the presentation. I got caught up in work here and wasn't able to join right away. So forgive me if this question shouldn't be asked, or I should be asking it to somebody else. One of the challenges we've had as YWCAs in talking to the federal government or even the municipal government about homelessness for women and advocating for the investments that we need is the data issue of how do you get the data on women when it's so hard to collect the numbers. So consistently, and I've spent a long time arguing with people about this, is, you know, what I'm told is there's 25% of the population of homeless people are women, not even mentioning gender diverse people, so just women alone. And so therefore, the rationale is 25% of the funding should go to women's issues. It's a lesser issue. And while important, everybody wants to say it's important and it matters. What they say is we don't have the data to substantiate and back up the funding requirements you think you need. So I just wondered if you could comment on that.
Well, I guess for me, I don't want, and I'm saying this as an epidemiologist who goes, you know, tries to look at prevalence of problems to determine whether it's, you know, a big issue or not. I don't think we should be looking at it that way. I think we should be looking at needs, and we've documented those needs, the complex needs of women who are not just homelessness, but at risk of homelessness because they're going to be evicted or they're fleeing violence. The fact that we've documented that exists, in my opinion, means we need to have programs that are addressing all of those issues in the complex way in which they appear. Because if we just try and say, here's the portable housing benefit, that alone is not going to solve the problem. And so I'm not sure we can convince policymakers that that's the way to approach it, but I think that's the way to approach it. The fact that we've shown that there are many women who are facing similar situations, and we know what causes these patterns, and we know what can prevent it. That's how we should approach it, not whether it's 25 or 27%, or so I think that's what we need to do. And I think we're starting to put those numbers together because that Pan-Canadian survey started to show you information about how women are experiencing precarious housing.
Dr. Alvarez, would you like to ask your question?
Hi, thank you. To address Medora's point as well, if I can add, and then I have another comment that might relate to that. Another way to frame it is that, as you know, the information that was presented here, it affects the kids as well. And so if you're looking at it from a life course perspective, all those 75% of men who are homeless might have also experienced trauma, probably have experienced trauma growing up. And so it's the perspective of, it's not just the women, it's their children as well. And so we need to stop the cycle in society of how people, you know, the traumas that they suffer, including precarious housing. So that might be another approach that might be helpful, as to be, you know, inclusive of everyone, but the fact that it's propagating issues in everyone. The other point I was thinking about, Dr. Ocampo, as you were talking, and thanks for the presentation, you were describing trauma, and, you know, 75% of, you know, homeless women, actually, I think it was higher, having suffered trauma, 97%. And then with, you know, people that were known to them. And I think that relates back to this comment about, I think when you take a step back, it's not about housing, it's about empowerment of women generally, and how society views women, the value of women. And it seems to me that the issue is much larger. Housing is a manifestation of it, but the issue is really around the value of women, you know. And if you look at other cultures, certainly there are some very prime examples of non-valuing of women. And of course, our society has also come from a lot of non-valuing of women ideas. And so, you know, kind of how do we take that step back and say, you know, we are on, you know, women are generally underpaid. They don't have, you know, it's like a cycle again of all these different confounders of just a general, you know, women's roles are this, the male's roles are this, and kind of how that undervalues women in general to be able to have those supports in place societally. That's just a comment. I don't know if I've probably 1,000 questions out of that, but
Thank you.
yeah.
Thank you very much, Elizabeth, for that comment. And I think, you know, being aware of the time, we'll maybe just give one more second to see if anyone else has further questions. And okay, so we have about 1 minute. So Chad, do you want to unmute and ask your question for Dr. Ocampo?
Yes, thanks. I'll just quickly thank Dr. Ocampo, more of a comment, just the impact of the presentation and where it might go. So I'm a subject matter expert with CMHC, and I'm looking at trying to understand different ways of realizing these underlying issues in housing, and being presented with this information and being able to make more connections from this presentation will definitely allow me to kind of take this and run with it in my work. I'm going to be an advisor with the FCM, so I'll be looking at who is applying for funding and what kinds of designs and developments are going to be introduced to move housing into the future. So I definitely want to bring this lens to those conversations, and yeah, definitely want to continue to understand more. I'm not an expert in this, so I'm just sharpening my tools and learning about it. So thank you so much.
Thanks, Chad. That's I'm feeling optimistic. It's a good optimistic ending. Thank you.
Absolutely. And Chad, I will echo your comments as well as others that have been placed in the chat. Dr. Ocampo, that was a very enlightening talk, gave us tons to think about, and this area I'm not terribly familiar with, and so I'm so excited to learn more. Thank you to Dr. Dunn for putting some references in the chat. We will be circulating the recording of this video for everyone who perhaps didn't get a chance to watch it in its entirety, or if you want to share it with others. But please join me in thanking Dr. Ocampo once again for such a great talk and for joining us today.
Thank you. Thanks a lot, everyone. Thanks for your
Thank
time.
you.
Bye.
Bye. Take care, everyone.